You are listening to episode number 107, Fastest Way to Losing Weight. Now, this is something all my clients want when it comes to weight loss. This is what all of us want. They have heard people who have lost 30 kilos in 3 months, and they want exactly something like that. Losing 1 kilo per week is not enough. Not gaining the weight in that particular week is also not good enough. They want that fast weight loss, maybe like 2 or 3 kilos of weight loss that week. So, in this episode, we will talk about why our brain wants that and how it affects the weight loss. Also, what are the standard weight loss patterns, or what is the standard weight loss speed? What is the fastest way for sustainable permanent weight loss? And what you get when you lose weight fast. So, a quick update on what's happening in my life. Now, we had Diwali and then lots of parties, and I was actually having a lot of sugar based teas. Um, like I was having brown sugar, and in between, I was having that protein shake if you were following me up. So, I gained some weight with that. Like, I reached almost 55 kilos. And I spoke about how I was okay with 53, 54 kilos. And I had let go my obsession around 52 kilos. So to challenge myself, my brain has now decided to go to 50 kilos. And the reason why I didn't want to go to 50 kilos, I have been in 50s, um, but I didn't like how it looked on my face. Um, and I just looked very skinny. And I'm talking about, this is the kind of weight loss I achieved when I had lost like 22 kilos suddenly. Now, this time I'm just going to go from 55 to 50. Now, the reason why I'm doing it is mainly because I want that flat tummy. Because I look skinny here, right? But I have a tummy fat. Now, when I was in my 50s, that tummy fat was not there. So I just want that. And what I want to achieve after that, once I reach there, is basically I want to be able to do push-ups, and I want to be able to do planks and a handstand one day, because I want to build my core. Uh, because I have back pain, I can't walk a lot. I have injured knees, so I can't walk a lot. And I mean, I can't lose any more weight. So those joints are already damaged. Now I can just like strengthen my muscles around it. And want to lose that weight just because, first of all, I want to see how a flat tummy would look and feel while still my face looking a bit skinny. And I'm pretty okay with it right now. So I committed to that. And my husband is also trying to lose weight. He is losing weight. So we are pretty excited with 2024. And I think one of my health goals is going to be at the end of 2024 to do a handstand, because that would be like so much fun. I already do a headstand, and that's fun too. But a handstand would be like, wow. All right. So let's start about the podcast today. Why do we want that fast weight loss? First of all, like, why does our brain crave for something like that? Now, as adults, we have achieved many goals in our life, many goals in our life. And we stop learning new things overall after school or college. We sometimes participate in trainings at work, but we do it only until the assessment is done, and then we forget until next year's training. We attend some lectures here and there, like whatever, basically trainings, right? For example, like for doctors and healthcare workers, we have to do this BLS, basic life support services, and ACLS trainings, which is mandatory in most hospitals. And we have to study for it. So every doctor gets like super anxious around it, super anxious, because then there is an exam and all of that. And we will get anxious till we pass those things. And once we pass those things, like it also demands some physical CPR giving and all. After that, we relax. And then we, of course, practice it in real time. We debrief at work. But it's not like the same thing. So we learn very occasionally. So as adults, we don't learn anything new unless there is some strong reward attached to it, like money or status or freedom. Like we attend those trainings at work because there is money attached to it or status attached to it, because if we don't attend, there are like consequences, right? um Even like we attend, like in college and school, we kept on studying more so that we can get freedom, which we can buy with money, right? So unless we don't see a reward at the end of it, we don't commit to it. So when we start doing the weight loss work, we expect to get quick results, like everything in life that has come at this point as an adult, right? Like we just get it quickly. We spend a day at work, we get paid. We study for an exam, we pass. But when it comes to weight loss, there are rewards like a thinner body, a better health, regular periods, natural pregnancy. But all of it will come after continuous daily effort. When we don't see that quick weight loss, we immediately want to give up. Also, so I actually, like, what I do is I make my clients submit their food journal entries to me on WhatsApp every day. So where they write down what they have eaten. And so I have evidence of what they have eaten. And many of them don't eat healthy half of the week, but they still want the weight loss. So when the weight loss has not happened, they start getting, like, they start questioning the whole process, like, how is this going to work? I'm trying so hard, it's not working, it's not working. Like she might lose weight, but she might not get a period. And then she'll be like, what's happening? I'm not pregnant, like, in 2 weeks, right? Our brains do that. It's not just my client's brain, it's all of us. Our brains do that. We want that quick result. And that's not our higher brain talking. It's like one of our parts or one of our lower brains function, which is like, it wants that quick gratification. But with matter of time, most of my clients, if they stick to the process, they actually start seeing how weight loss actually happens, and then they keep doing it, right? So one thing is, why we want that fast weight loss is because as an adult, we have achieved those fast results. We have reached a point where we figured out most of life, right? Next reason why we want that fast weight loss is because we don't really want to do what is required to lose the weight. We don't really want to watch what we eat. We want that freedom around food, right? We don't really want to exercise. We don't really want to manage our minds around food. Just like my client who wants to get healthy before she gets pregnant, but she also wants to eat healthy only till she gets pregnant. She will fight with me. She knows intellectually she needs to eat healthy in pregnancy as well, and rest of her life if she doesn't want diabetes. But in reality, she doesn't want to let go of her yummy food. It's yummy. I want it. That's what she says. So she will start doubting if healthy eating will actually help her cause, which is to get healthy before pregnancy. And I want to offer you to just consider that maybe this expectation of your brain for a quick weight loss is just its way to not do the required work for weight loss or being healthy, right? Because once you get away from that unhealthy food habits, unhealthy sleeping habits, exercising habit, just your life habits, you will come to your normal weight, right? But you have practiced doing that, and it's that part of you who doesn't want to let go of this habit because there is gratification in it, right? So as anything in life, weight loss will come easily once we patiently do the needed work of reducing our carbs, improving our movement and sleep, and reducing our stress. Now let's talk about what is the standard way to lose weight. Now CDC recommends that those who lose 1 to 2 pounds, the Center of Disease Control, right? CDC, they recommend those who lose 1 to 2 pounds or half to 1 kilo weight per week gradually and steadily are more likely to keep the weight off than people who lose like fast weight, like 10 kilos in 2 weeks, right? So those who have gradually lost the weight, it's like you have given your body an opportunity to understand that you're losing weight instead of like that fast weight loss and you will gain it back. Now, all of us would lose the weight if we decide to make those slight changes in our lifestyle, like no snacking. That one was huge for me. That one works for me all the time because I am someone who gains weight every time I snack. I used to be someone who used to constantly snack, and the moment I stop doing that, I lose the weight. But many of my clients want to keep their snacks. So for them, I offer reduced portions or reduced carbohydrates, reduced refined carbohydrates, and that works for them. But no matter what, you need to remember to check your attitude with which you are losing weight. Are you like white knuckling and like using a lot of willpower to lose weight? As you will give birth to a part of you, a part in you who's going to remember how uncomfortable this whole weight loss process is. And she is going to let you not lose weight again. Because that's what happens, right? Like once you lose the weight, many of us slowly, the weight will come back because, you'll stop using that willpower, you'll stop managing your mind around food, and then it will be hard again to lose weight. Or you will lose the weight and then again gain it and again lose it and again gain it. Constantly, don't try to change your actions about eating or not eating something. Check your attitude behind it. Like for me, as I said, I love snacking. And what I did was I replaced my snacks with coffee, black coffee. And it didn't matter what time of the day I was having black coffee because earlier, because I used to work nights, I used to work days. So this is just like, it doesn't matter. There was no sleeping pattern. So it worked for me, that black coffee. But then when I started working as a coach where I'm sleeping every night, I can't afford to have coffee in the daytime. Like I need to finish my coffee by like 11 a.m., 12 p.m. because after that, if I keep having coffee, I will be up in the night. And slowly, the sugar will creep in. It will, like when my mom, dad came over, they were having tea and coffee, and I started having tea and coffee with sugar. And my brain was like, it's okay. You're not gaining weight. You're not gaining weight. Nothing is happening. You see, you're well. Slowly the weight gain happened. And 55 is a number where I'm like, okay, enough. We don't want to like continue doing that. And that attitude, okay, enough. That sort of puts me in place. And I'm like, okay, enough of that crazy thing. We know sugar causes us weight gain, even if it's brown sugar, even if you're healthy and exercising and whatnot, just stop it. And I am able to like stop sugar like this because sugar is addictive. You have one cup of it, you will want another one. You'll have another one. You'll have another one. At least in my case, it works that way. So just have to stop it abruptly and manage your mind rest of the time. And I've been doing it for like a week and I already lost like half a kilo. And it can be that easy, really, without so much drama. Now, all of us would have to use a little willpower, right? Um, to make those decisions ahead of time, like for at least a week. Decisions like what kind of foods we want to eat, how we want to eat it, how we manage our mind when we want to eat something unhealthy, how we manage our mind after we have eaten something unhealthy. Like you can decide how you're gonna be ahead of time. Once you get objective about your weight loss, you gather data, you assess what is working, what is not working, and then decide how you will strategize for next week, then this whole weight loss process becomes systematic and organized. And that's how your brain will come to know, oh, okay, this is how I gain weight. Oh, this is how I lose weight. And then you keep doing it again and again until you remember it, until it becomes effortless. And still, you will go back to your old eating pattern. Sugar is addictive. So you have to be aware of how you behave around sugar. Now, let's talk about what is the fastest way for that sustainable permanent weight loss. Now, this is what I do in my coaching program. When my client comes for the first session, we narrow down the foods you think that are healthy and you think that are unhealthy. So you can run through this whole process, like you can pause this video and like answer that question, what foods do you think are healthy and what are unhealthy? As per me, anyone with PCOS or insulin resistance or who's obese, you need to stay away from flour and artificial sugar. Anything which is made from flour, rice flour, wheat flour, any kind of flour, just stay away from it until you have lost the weight and then maybe slowly introduce it. Now, it depends, right? Like so many of my clients might get constipation and then I might like add some flour or some form of bread or some form of rice. Rice is also okay, but sometimes people can tend to overeat it. So a little bit rice is okay for me. Now, to become so you need to stay away from these flour and sugar based food, artificial sugar based foods, to become insulin sensitive while you're not starving to death. You need to eat healthy, delicious, nutritious foods which are protein rich, which you can add some plenty of fruits and vegetables, and also good fats, because those good fats are good for your heart. They're not going to cause that cholesterol problems. The bad fats are the ones when you deep fry things. Those are the ones which cause you cholesterol issues. Now, many of my clients are resistant to the idea of giving off flour and sugar, and I don't force them. They have their idea of healthy eating, and we keep it and we see what happens. So many of them like will reduce their portions while having flour and sugar-based foods. And if they are seeing weight loss with that, I tell them carry on until weight loss is happening. We are not gonna like stop that. You can keep your flour, but if you stop losing weight, then that will be the first thing we might have to look into, right? So I asked them to keep a food journal. So for the whole week, that whole first week, my clients send me their food journal entries. So for you, you will need to do that on your own. I offer you to keep a reminder on your phone and write down the time when you eat, what you eat. And if you want to measure portions, you can do that too. Get as objective as possible. This is data about you, right? Like it's always fun to gather data about yourself. A bit narcissistic, but I like to be that way. Now, in the second session, we review everyday food entries of how they were eating throughout the week. There is a pattern of how you eat. You get to see how often you eat, what kind of foods you eat, how you eat on the weekends, how you eat at work and at parties. So, in this second session, we decide on the plan of eating. Many will decide for, say, no snacking and 2 meals a day and intermittent fasting. Some will decide 2 meals, 3 snacks. So we write down the plan for that week, and the goal throughout the week is basically to follow that plan and also maintaining that journal and sending it to me. So all most importantly, you have to objectively gather the data. Don't do it in your head. It doesn't work. I mean, you can try it, but it will not work because our brain has a lot of things. We multitask, we go from one thing to other, and we easily forget. Now, during the third week session, we review the journal again of what actually happened. Did they follow the plan? So many of them who decided for 2 meals a day, they will be like snacking 3 meals, 4 meals. They will be like, they will find evidence of how they actually eat. They were not able to follow the plan, right? Or we will check whether they lost the weight. Many times they will forget to write in their food journal. And that's where I ask them what they ate on their WhatsApp. Like every day they will get a question from me of what happened, right? On coaching sessions, we discuss why they couldn't do as planned. We uncover the emotions that they are trying to suppress with food. You can do that too. Like if you have a food journal, you've written it in pen or pencil, use a red pen to highlight every time you didn't eat as planned or you overate and answer the question why. Why did you do that? Or label an emotion next to it. Like, were you anxious? Were you scared? Were you tired? Or if you forgot or you didn't write in the food journal, find out why. Why did you forget? Like so many times for me, it would be like, I just forgot. I'm like, okay, if you just forgot, can we start again? And how can we remember next time? So for me, remembering is like constantly like I club it to a habit, and you would have heard it in the past episodes. I like to club it to a habit, or it's part of my data collection, which I do every day. Sometimes I forget, and the moment I remember, I just go back to it. So sometimes it can be like after 4 weeks, sometimes it can be after 4 days, sometimes it can be daily. So try to do it as much as possible, right? And recommit to writing in that journal. So after that, every session, what we do is we meet and we review their food journal entries and solve any emotional problems they faced during that week that made them eat emotionally. If they're not losing weight, then we tweak their meal plans. We continue working for until they have lost the weight and when they are in their maintenance so that they don't continue further losing the weight, I support them for another quarter or 6 months. And some of them will continue working with me for their next goal in life because they like the whole idea of solving their emotional problems. So, my clients actually start losing weight mostly in week 2 to 3. They sort of adjust to the mindfulness strategies of planning and eating as planned in by that time. So the fastest way for a sustainable permanent weight loss is basically to stick to a plan which your higher brain makes and finding out. So stick to a plan for at least a week and find out what are the emotions your brain is trying to suppress with food, and if you can solve them, right? So if you try to do that, like higher brain decides this is the plan to eat for a week and see if you gain weight or lose weight, I recommend checking your weight at least once a week so that you don't suddenly see yourself like 10 kilos heavy. Every week check your weight and like write down in your journal, like please supervise your brain, give your brain instructions what to eat every day, otherwise it's just going to take you for a ride. It's going to eat all the sugar and it's going to overeat and you're going to get sick. And learn to find out the emotions, like that is like improve your emotional vocabulary because you don't know that. Learn to do that so that for the rest of your life you know how to manage your mind and your emotions. Lastly, what do you get when you lose weight fast? Now, if you are someone who has lost 10 kilos in 2 weeks, I actually don't know of anyone who did that, except for maybe sick patients who do lose weight drastically, especially when they're vomiting or are having loose motions. They're not able to eat at all. Many pregnant women lose sudden weight in weeks when they don't eat at all and they are constantly vomiting. And that's dangerous, actually. They need electrolyte imbalance correction and they might need an ICU admission. It can be that sick, it can kill them. Now, we don't want that kind of weight loss, right? As your body will try to come to homeostasis eventually. Like there are some people who just stop eating, and that weight loss will happen, but then you will gain it back because your body will be like, okay, she's back to the normal place. She was in a desert where there was no food, and now she has all the food. Let's go eat. We need to catch up. That's just going to happen automatically, right? And you will gain it all back. This generally happens when your attitude towards weight loss changes. So always be aware of what you're thinking when you're eating something. Many patients after weight loss surgery lose weight fast, but they are under constant supervision by a team of medical experts who are monitoring them closely. They're also getting emotionally supported as all the emotions which they try to suppress with food earlier are super raw and on the surface. Now, they might not gain the weight back, but I do know of many who have. So, if your mind wants to eat, it will figure out a way to eat even when your stomach hurts. Now, if you lose, say, the ideal way of weight loss, which is like zero point 0.5 kilos to 1 kilo per week gradually until you reach your goal weight, knowing exactly what food causes you specifically to gain weight or lose weight, your brain registers that. It just is like, oh my God, what? This happened? I can't believe it, right? Like it gets shocked, like it firsthand registers it. Now, once you reach your goal weight and you are in maintenance, you will go through another drama because that point you'll be like, okay, I can't keep doing that, otherwise I'll disappear. So you need to keep checking on the attitude that you have towards your health and your food. And that will decide how you go through those times. The bottom line is always remember what attitude towards your eating you have. Are you eating to cope with your daily stressors? Are you able to interrupt the cravings of addictive foods? Are you scared of gaining weight or losing weight again? Are you living in the moment and thinking you'll start tomorrow? Or you're like, oh, I started eating already. Let me just eat it now. It's gone. So you can keep an eye on your attitude by simply coming to your food journal every day. This is what I do to myself. I barely get coached on food. I'm a weight loss coach, but I get coached on all the other things. But food is something I manage on my own. And this is what I ask my clients to do as well, to remember to come to the journal no matter what. Now, if you are someone who understands this process intellectually, has been following me and not able to get the results, or not able to apply it, you need to jump on a clarity call with me. Let's review where you are, what your struggles are, and let's find out if I can help you in your weight loss journey. All right. So the clarity call link is in the bio. I will see you there. And for all of you who are managing to stay healthy, congratulations. And I will see you next time. Bye bye.